Coronary artery disease means blockage of the arteries which are supplying blood to the heart. Now we know that the heart supplies blood to the body, but then it needs energy for itself also, and that is being supplied by arteries, which are called coronary arteries. So when these get blocked for whatever reason, which we'll talk about, then we call it coronary artery disease. Okay, so that produces, in simple words, that is a heart disease. So that is, and why are we so much worried? Why are we talking about this? Because heart disease is the number one killer all around the world. And if you take the numbers for the last 100 years, you take the first 10 causes of death, then number 2 and number 10 will change over 100 years from TB to malaria to AIDS to trauma. But the number one killer, unfortunately, remains the same, and that is coronary artery disease or heart disease. But the basic thing is that there is a accumulation of cholesterol and fibrous tissue inside the artery. So if the artery is this big, then part of it is being occluded or blocked by a blockage of atheroma. In simple words, what is atheroma? That is fat. So what we call cholesterol, actually it is not so simple, but just for explaining, cholesterol, fat, and fibrous tissue collects inside the artery and causes the blockage. Now, why would that happen? Number one is as you age, it happens. Who are dying at a young age, 30s, 40s. And the reason now is, firstly, it is the diet. We are eating too much. And it is not just eating too much, we're not spending any energy. So we are not even walking towards the food, we are getting it on our table. And it is all, what we are eating is, quite a lot of it is junk food. Now, what is junk food? Junk food means something which has empty calories. That means whatever fats and carbohydrates are there, they are just immediately absorbed. There is something called complex carbohydrates, which is what we need so that the body takes time and breaks them down. And the second is simple carbohydrates like sugar. So if you take 2 teaspoons of sugar, that is immediately going to raise your blood sugar level. If you eat a Big Mac with a lot of cheese, that will raise your cholesterol immediately. So that is the number one point, that is diet. Number 2 is sedentary. Most of us, including myself, maybe you also, I don't know, we are bound to the office, bound to the computer, and we hardly do any regular exercise. So you need to do at least half an hour of brisk walking, which we are not doing. Third is stress. Again, everybody has stress. I have stress. You have stress, whether it is deadline or reporting to the boss, or there's so many family problems. For the ladies, it is an unequal field. Not only they have to work in the office, sometimes they have to work at home also, which is not good, that you are having to have two sort of professions. So that increases the stress. Fourth is smoking. Luckily, smoking has reduced. The government has taken very good measures so that it is not allowed in public. So the number has gone down. But there are still some people, especially young people, who like to smoke because it makes them look cool. So actually, it's not cool. So smoking is something which can be easily prevented. And we should all, as a public service, make sure that nobody smokes, especially not the youngsters. So these are 3, 4, and of course, obesity or having a body weight more than what is the ideal for your height and your age. All of these contribute. So if there are 3 factors, like if you smoke, you're overweight, and you eat junk food, then your risk of heart disease goes up 5 times. And if in addition to this, you are not exercising, then it becomes 8 times. So all of these are compounding factors, which all of them, okay, one more reason is condition like hypertension, like diabetes. Again, both of these are treatable. So please, if you are above 30, 40, get your blood pressure checked at least once a year, if it is normal, and your blood sugar checked. Unfortunately, India is now the number 1 It is the capital of diabetics all over the world. And it has been shown very clearly that diabetics have a very high incidence of heart disease. In fact, if you go to your doctor and you are a diabetic, his treatment will start as if you have heart disease, even if you don't have heart disease, because he knows that diabetics are going to have some degree of heart disease. So similarly in hypertension, you can easily treat it. What mistake people do is they say, oh, my blood pressure was high. I've taken treatment for 2 days, for 2 weeks, for 2 months. Now it is okay. So they stop medicine. So that is not right. You cannot stop medicine without a doctor's advice. Similarly, in blood sugar, they say, oh, I am eating gulab jamun, but I'll have one more tablet of my anti-diabetes medicine. So it doesn't work like that. So you have to have dietary restrictions. And in fact, I'll go to the extent to say that sugar should be removed from the household. So don't carry any sweets into the house. If there is a celebration, have a small piece. Don't keep sweets in your fridge. So these are the causes. So this why heart disease has suddenly uh, taken a new percentage of young patients besides the middle-aged ones. Sometimes we tell the patient, why didn't you come early? He said, I didn't know that my chest pain meant heart disease. So, and it is our fault as doctors that we did not give this information. So to come back to the question, the symptom, most classical symptom is pain in the left side. So this is my left side, pain in the left side of the chest, radiating to my left jaw or my left arm. This is classical. If anybody says I have pain on my left chest, then we presume it is heart disease. Sometimes you may have just sweating. Again, one should think of heart disease, or there may just uneasiness. So any symptom besides the classical chest pain, if you have, and it doesn't go away within a few seconds, then you must at least see a doctor, even your local doctor, he is good enough, and get a ECG and if required, a blood test. And these are available in most cities, in most towns, even in most of the villages, you can get an ECG from your local doctor. And the ECG will quite often tell you whether it is heart disease or not. So that was about the symptom. Sometimes symptoms in diabetics, there may be no pain. So anything which makes you feel uneasy, the patient says, sir, I'm just feeling uneasy. So at least get an ECG, especially if you're diabetic. So that is about the symptom. When I started my practice in 1988, the common age was 50 to 70. That is middle age and nearing older age. But now over the last 30 years, the age has dropped to 40s. Over the coming years, if we are not careful, in 20 years, my children will have a shorter lifespan than myself. So we don't want that our children should die before us because of heart disease. 30 years back, ladies only after menopause would get heart disease because estrogen in a lady protects her from heart disease. But again, in the last 30 years, ladies are getting affected more and more. Maybe the reason is that they are working more, they are having more stress, cooking at home, working in the office, so many things. But the fact remains that ladies, middle aged and younger, are getting heart disease, which was not there earlier. So this is just in the last 3 decades that we have seen this change. And this is very disturbing, both the age and the sex. Anything is like a fire starts in a corner of your house. And if you leave it untreated, then obviously it will be a disaster. And a heart disease has very good treatment now, besides prevention, which is number one. Treatment, we have very good drugs. We are able to treat 90% with medicines. 10% will need surgery or ballooning or stenting. That if you have been diagnosed with heart disease, then do not leave it untreated. Get treatment. Treatment is available. It is not expensive. And the first treatment which a good doctor will give you will not be medicine. He will tell you lifestyle changes. You change your diet, exercise, reduce your weight, control your blood pressure. So it is not expensive at all. It is, in fact, a lifestyle disease. So you will have to change your lifestyle, and that will only reduce the cost of your life, so of living rather. So it is not expensive. Take treatment from a good doctor. Prevent, of course, was earlier, but if you get it, not to worry. Treat it. If you don't treat, then that is a recipe for disaster. I'll digress a little bit about the diagnosis. So one was we told was the symptoms. Second is the ECG. Third is a test called an echo. This is a painless test. We just look inside your heart with a machine. Fourth test is a treadmill test, or we make you walk and do the ECG. And we can diagnose with some certainty whether you have heart disease or not. And finally, if we are still not sure, or if we are sure we want to know how much, then we do an angiogram. So angiogram is of two types. One is a CT angio, where you don't need to be admitted. It is like an X-ray of the heart. And second is a conventional angio, when you need to get admission at least for half a day. And with both of these, we can make out how much is the heart disease, how much is the blockage, and that helps us in the treatment. So now to come to the treatment. First thing is lifestyle changes. Change your diet. Don't eat rasgullas. Don't eat gulab jamun. Exercise every day. Reduce the level of stress. But if, in spite of this, your heart disease is there, then we have very good medicines, extremely good medicines, which will reduce your cholesterol, which will reduce the stickiness of the blood so that it doesn't clot, and reduce the working of the heart. And these should take care of the majority of the patients. But in case they don't, because if the disease is more advanced, then we will do the angio, and either if it is single vessel in a patient who is not a diabetic, we will open up the artery with a stent. But if the patient is a diabetic or it is more than single vessel, then the best treatment is a bypass surgery. Now people get scared of bypass surgery. Now please, bypass surgery is no longer a heart stopping experience. Literally, I'll tell you why later. It is very safe, it is predictable, and it is available in all cities, tier 2 cities, and some of the lesser, smaller cities also. You don't have to go to Bombay or Delhi. You don't have to go to New York. You can get it done sitting in your own city. Most of my colleagues are very well trained and are able to perform a predictable surgery which will last you 30 to 40 years. So that is about the treatment for heart blockage. See, even after surgery, I forgot to tell you earlier that this is not a cure. Your disease is still there. Unless we have to help the patient to root out the disease. What I am doing is just putting a spring or doing a bypass. The internal environment, I'm not changing. So I have to tell the patient, change your lifestyle, eat homegrown or home cooked food, and exercise. If you have blood pressure, high blood pressure, treat it. If you have high sugar, diabetes, get it treated. If your weight is much above, then please take exercise and take the doctor's help to reduce your weight. Because I stress again, once I told my patient, I met him at a social function, and he was eating rasgullas and gulab jamuns and cham cham, and eating a lot of non-veg food, curried food. And I asked him, hey, what are you doing? He said, doctor, you've done my bypass. I'm cured. So I was shocked, and I told him, please, we have treated you to maybe increase your lifespan, but we have definitely increased or improved the quality of your life. But unless you take precautions, your lifespan may not increase in spite of my surgery. So of course, your quality of, earlier you were not able to walk. Now you are coming to a wedding and eating well and socializing, which is what we want. But if you don't take these simple precautions of eating and exercise, then my surgery will not last forever. So it is not a cure. It is not that I have removed the disease and thrown it out. I have just bypassed or I have opened up a block. The reason why your body produced the block remains. So we have to involve the patient. So it is very important. I do a lot of talks like this. I do camps where we don't say come to us for surgery. We tell them, please avoid these things so you don't need to come to us. So that is a very important point that you have raised. I've already told you some of the lifestyle changes. One more thing I'll tell you is a simple exercise, which is Indian, that is yoga or yoga. So at least now in sitting in front of the TV, we can do yoga. There are a number of free classes or not free, even if it is not free, doesn't matter. So those are helping us, our heart to recover, our lungs to become better, our oxygen level to get better. So yoga is an important part of what we call as rehabilitation. So my after surgery, I put my patients in a rehabilitation course where they have to or they are helped to do exercises. So this is very important. Of course, diet has to be changed. Spicy food is out. Okay, alcohol, you didn't ask me. I will, earlier I used to say, okay, one drink a day is okay. But now, since nobody or most of people are not able to stop at one drink a day, our advice is absolutely no alcohol. So the stop drinking. It is not the treatment of our disease. Absolutely, absolutely, absolutely no alcohol and no smoking. Both of these are non-negotiable. So you may, have half a piece of gulab jamun, but you are not allowed, or you should not smoke or have alcohol at all. So these are some of the important points. And of course, yes, one very important point. If you are married, make sure you are on good terms with your wife or your husband, because marital discord is one of the biggest stressors of life. So I advise all my couples, I call them together so that they both realize that the stress is not only harming the patient, but also the person who's not a patient. So be on good terms with your wife or your husband. That is one of the biggest advice I give nowadays to my patients, along with doing yoga.